Good morning, good afternoon, good evening to you, ladies and gentlemen. Thank you for the invitation to this important post-COP11 webinar on industry liability in line with FCTC Article 19. I have two objectives to talk with you. First, on technical issue, how much the liability can be estimated. Second, what administrative and other non-judicial measure we can use to enforce the liability. First, on how much the liability. I have reviewed and found that we need the following key evidences. The burden of disease attributable to tobacco use in terms of number of outpatient and inpatient cases. Or we can estimate daily lost, disable adjust life year loss in terms of the combination of year of life loss from tobacco and year living with disability from tobacco. Second evidence, the annual total national health spending for the treatment of conditions related to tobacco use, as well as percent of total government health spending. If a country having out-of-pocket payment high, then we need to cover household spending on the treatment of conditions related to tobacco use. Third, with the application of human capital approach, which value that the discount present value of future income lost due to premature deaths. This method has been used by World Bank very often. It links health outcome to productivity loss as well as economic growth or lost for mortality. There was empirical application which typically estimate loss using GDP per capita and year of life loss, which is very simple, but there's some metrical limitation. When we combine number 2 and number 3, i.e. the annual health spending plus annual human capital lost equal to total liability that tobacco industry are liable to pay. Then finally, how much each tobacco industry pay annually? I think it's very simple. We can apply pro rata allocation to each industry based on the proportion of the total annual sales. If industry A has bigger sales, they have a bigger liability to pay to the government on annual basis. Next, what administrative and other non-judicial measures should be introduced to implement the liability issues? I think political process is so important. I would suggest that there is a close engagement and political buy-in by key actors in political party, both government and opposition parties. And we must not underestimate the pushback by industry. As we observe, the policy and regulatory capture is not uncommon in an integrity detracting country where the CPI also detracts. It is politically not feasible, I think, that Thailand introduce another new law on industry liability in line with FCTC Article 19. Therefore, the only way is to review the Tobacco Product Control Act. Look at which provision in the law are the key entry points for implementing Article 19 of FCTC. All this should be in consultation with progressive lawyer and civil society, etc. Finally, how we move this forward. I would foresee convening series of workshops among key actors on way forward, both technical and administrative and judicial measures to be applied. Key actors include public health, CSO, academia, Thai Health Foundation, and key progressive lawyers, and must be supported by the technical know-how by FCTC individual secretary. The webinar may consider Thailand as a pioneer in taking this forward, learning from it, and we share and learn cross-country learning collaboration for the implementation of FCTC Article 19. I thank you very much for your consideration.